Well, hello there again. Hello there, everyone. Thank you all for being here. My name is Dr. Camille Brockett Walker, and you are here at the open house for the Emory Graduate School. So we'll get started. Let me go ahead and share my screen so I can go through this PowerPoint, okay? All right. And I will start from the beginning. Can everyone see my screen okay? All right, very good. So as I said, welcome to the open house here at Emory School of Nursing, where we'll be discussing the Adult Gero Acute Care Nurse Practitioner Program. I hope everyone is in the right place here. I know we've had different open house sessions throughout the day and over the course of the month, but if you are in this Zoom link, you are interested in becoming a acute care NP. So as I said, my name is Dr. Camille Brockett Walker. I am an assistant professor here at Emory University. I've been here now since 2018. I am also the interim program director for the Adult Gero Acute Care Nurse Practitioner Program. I actually completed my master's at Emory many moons ago in 2007, I believe. I did the ENP and FNP program at the time. And so I've been a nurse practitioner for 16 years now. I did go ahead and complete my DNP, Doctor of Nursing Practice degree at Mercer University. I finished that up in 2018. So as I said, I've been a nurse practitioner for 16 years in different clinical specialties, ranging from emergency medicine, to hospital medicine, inpatient oncology, and I'm currently a critical care nurse practitioner working at Grady Memorial Hospital in the medical ICU. As far as my service activities, I am an ANCC item writer for the Adult Gero Acute Care certification exam, which is very great because that allows me to kind of know how to prepare my students for sitting for that certification exam. I am also on the diversity committee for the National Organization of Nurse Practitioner Faculty. I am also a member of DNPs of Color. And here at the university, I am on the faculty search committee. So that's just a couple of things about me, which is also a good segue into my area of scholarship, which deals with increasing nursing workforce diversity through the recruitment and retention of faculty of color, as well as that transition to practice for acute care NPs. So that's a little bit about me. Let's see if I can move the screen forward. So getting into the adult gerontology acute care NP specialty. So this specialty is a specialized area rather of nursing practice that focuses on the care of acutely ill adults and older adults. So no pediatrics in this specialty. It's all adults and older adult population. Also, acute care settings include obviously the ICU, as well as specialty inpatient service lines and specialty clinics. So what I mean by that, as you all are probably familiar with, so inpatient cardiology, neurology, different inpatient specialties that you, I'm sure, see come rounding in the hospital, or your patients are admitted to specific service lines. I also have here specialty clinics. That's one of a key question that I always get from students as well as healthcare systems is, can acute care NPs work in a clinic setting? So you most definitely can work in a specialty clinic setting. So all of these inpatient specialties that I'm sure you're familiar with all have clinic. So it's not unusual if you are, rounding in the hospital, but you might see patients in clinic sometimes, whether that's cardiology clinic, pulmonology clinic, things like that, general surgery clinic. So you can work in a specialty clinic area, just not in a primary care capacity. So The role of the acute care NP. So first thing is assessing and managing acute illnesses and injuries in adults and older adults. Again, not the pediatric population, but sticking to our population, which are adults and older adults, and acute illnesses. So these are illnesses that patients are presenting with in the hospital setting. Secondly, collaborating with multidisciplinary healthcare teams to develop and implement treatment plans. So you're working with physical therapy, occupational therapy, social services, nutrition. You're consulting different services depending on what your patient is presenting for. So it's a very multidisciplinary approach as we're taking care of patients in the hospital. And thirdly, monitoring and evaluating patient outcomes. And then lastly, providing education and support to patients and families in the acute care setting. So scope of practice. So performing comprehensive assessments of adults and older adult patients. So of course, you're going to be physically examining your patient and making diagnoses depending on the information that you're getting from your physical assessment, as well as labs and imaging that you're getting. So which leads to ordering and interpreting diagnostic tests. So you will be looking at X-rays, looking at CAT scans, looking at MRIs, and interpreting labs and things, all, to culminate to hopefully a diagnosis for your patient. You'll also be prescribing medications and treatment plans for your patients, and then performing invasive procedures such as inserting central lines and chest tubes. We have students who are in the OR who are harvesting veins. So lots of really cool procedures that you are able to do as an acute care nurse practitioner. So a little bit about our program specifically. So the length of our program. So if you are going to be a full-time student in our program, it is a 4-semester, 48-hour program if you're pursuing it on a full-time basis. We have introduced the new MSN Flex program, and that essentially is trying to make it the program as flexible as we can for the working nurse, right? So if you choose to pursue the program full-time, it is 4 semesters with a fall start. If you choose to pursue it part-time, it is 7 semesters with a fall start. And then you can also have an option to start part-time in the spring semester. Most of our students do usually start in the fall semester, but we do have an option for spring semester as well. Some of the unique highlights for our program. So students in this program receive broad exposure to managing the acute and complex clinically ill patients and are educated to work as independent practitioners and as members of the interdisciplinary team. So, and that leads right into our clinical hours. So you will get this type of experience as you are going through your clinical hours. Our clinical hours, I would say, or clinical experience is something that I think is very unique to our program. This is Emory University, and we have strong partnerships with Emory Healthcare. If any of you are here in the Atlanta area, Emory Healthcare has sites all over the metro Atlanta area. So we definitely have a broad range of clinical experiences for our students. And our students complete over 800 hours of directly supervised clinical practice, either with a physician or an acute care NP preceptor. We do not precept with PAs. We stick to physicians or acute care NPs. And it's very important to us that our preceptors are certified as acute care. There might be some hospital systems where they might still have family nurse practitioners working in the acute care setting. But for our students, we make sure that our preceptors are either physicians, as I said, or actual acute care certified nurse practitioners working in that clinical setting. So over 800 hours, specifically 840 hours for our MSN program. If there's anyone here that's interested in the DNP, we do also offer the DNP program with the acute care NP attached to it, and those hours are over 1,000 hours. So specifically 1,140 hours for our DNP program. And some of the career opportunities, so students graduating from this program have opportunities to work in the acute and critical specialty settings. Graduates have also found positions in critical care, trauma surgery, general surgery, and all other inpatient specialties. One thing that I think, used to be kind of an old school mindset is that acute care was synonymous with critical care. And I can't stress enough that being an acute care NP does not necessarily mean that you want to go in critical care. It doesn't necessarily mean that you are a critical care nurse or you have to be a critical care nurse. Acute care NPs are NPs that work in the acute setting, which is usually within the four walls of the hospital. Okay. So also program requirement. So enrollment into the acute care NP program requires that you have at least 1 year of professional nursing experience as an RN in an acute or critical care setting. So a lot of our nurses that enter our program do have critical care experience, but that is not specifically required as far as the type of experience that you must have. So if you're working on a telemetry unit, if you are working in step down, those type of areas would lend well to being an acute care nurse practitioner as well. We do not consider the ER as an acute care setting. Emory does have a separate ENP program, emergency nurse practitioner program. So if you're interested in, if you're an ER nurse and interested in remaining in the ER, that would be a better program or a better fit for you. But our experience is inpatient nursing experience. And so this is just, I wanted to give you all an idea of some of the some of the plans of study. So this is the full-time MSN plan of study with a fall start. So as you can see, this is 4 semesters long. The first semester, I'm not sure if any of you have gotten a chance to go online and take a look at our plans of studies, but as you can see, it's very intense if you are planning to start this program on a full-time basis. Just that first semester alone, you're taking advanced health assessment, patho, and pharm, and one of the introductory acute care courses. So it is a heavy load. That being said, we don't recommend that our students work full-time if they are going to do this program full-time, because as you can see, it's a very rigorous and intense program if you are choosing to do this on a full-time basis. And then as you can see, as you go on in the semesters, you have some other foundational courses like becoming an APRN and research and evidence. And then you have your acute care specific courses. So AGAC and P1, along with the clinical practicum that goes along with that course. So you do not start your clinical hours until the second semester of the program. As you can imagine, if we had clinical hours associated with that first semester when you're taking pharm, patho, and health assessment, that would be a lot. So your clinical hours start in the second semester of the program, again, if you're taking this on a full-time basis. And you'll see you'll do 240 hours that second semester, 240 hours the summer semester, which is the third semester. And then lastly, in the fourth semester, 360 hours. That summer semester, as you can imagine, summer is a bit shortened. So it's almost a little bit less didactic class time. And you're, focusing really on getting your clinical hours. That being said, this program is a hybrid program, if you will. So we have synchronous and asynchronous sessions. And then we have the expectation that you would come on campus about 1 to 2 times a semester. So for instance, right now we're in fall semester. So I have students in this first semester here who are taking diagnostics and clinical reasoning. And we have where, they are doing asynchronous learning online, maybe for 3 weeks at a time. And then we come together synchronously and do a case study review day. So it's very flexible in that, you're not always in class. every single week, but it's definitely something that you must keep up with, being asynchronous and synchronous and having intensive days. Okay. And this is the program on a part-time basis. So as you can see, some of those harder classes are separated a bit. So you'll have Patho and Pharm in that first semester, then becoming an APRN and research, and moving on down. So the actual clinical component of this plan of study, if you're starting on a part-time basis, does not start actually until that fourth semester. So you're kind of getting some of those foundational courses out of the way that first year. And then the second year is when you're really focusing on your major clinical coursework. And then we also have the DNP plan of study. I'm not sure if anyone here is interested in pursuing the DNP, but if you are, this is the DNP plan of study. And this plan of study is over 7 semesters. Go back for you. And again, the clinical component of the plan of study for the DNP students does not start until that third semester as well. So if you're part-time or if you're a DNP student, we try to get some of the foundational courses out of the way so that when you are starting your clinical courses, you have the time to do so, especially that you will be doing clinical hours associated with this. And I just wanted to include just a couple of pictures of some past students. Some are current students actually as well. Health assessment here we have going on the left. We're using the otoscope. In the middle here, this is an example of our airway day. As I said, we have intensives where you do come in 1 to 2 times a semester. So these are the things that we're actually doing in our intensive days. On the right here, you'll see Dr. Cindy Powell, who also works in our program, and she's demonstrating some health assessment skills. We also have a multi-skills day as one of your intensive days. So we're doing airway. We have pig lungs and pig hearts that we're looking at and dissecting. And on the left here, this is the heart, and you can actually see a pericardial effusion here on the left. So it's just really cool, these intensive days, because it kind of allows us to apply all of those things that we've been learning didactically and really get some hands-on experience with that. And this is just another airway day. And, we're using ambu bag and PEEP flows and everything to inflate the lungs, as well as using the ultrasound. We have an ultrasound day as well that we're using ultrasound to do certain scans of the body. So these are just some of the examples of the things that you would be doing in our intensive days. And this is a graduating class, probably about maybe 2 years now, who's graduated at one of their intensive days. So just to go over some of the important dates. So if you're interested in a fall 2024 start, the application deadline, the first round has already passed August 1st, and those decisions will be released on October 6th. The second round, the application deadline is October 16th, and those decisions will be released on the 15th of December. And the third round application deadline is December 15th, and you will hear your decision by January 26th of 2024. All right, so I know that was a lot of information, but I am ready to take any questions. I'm sure there are questions if you have any about the program. And please, if you do, introduce yourself, tell me your name, kind of what your experience is, where you're coming from, and I'll be happy to talk with you.